Welcome. In this session, we're going to speak about nutrition. We'll focus on the importance of nutrition to global health, the nutritional state of the world, key nutritional issues, and what we've learned might be done to address some of those issues. By the time you finish this session, you should be able to define key terms related to nutrition, describe key determinants of nutritional status, discuss the burden of nutrition-related problems, review the costs and consequences of those burdens, and discuss measures that can be taken to address some of the most important nutritional concerns. Let's start with some vignettes and then probe some of our students about them as well. Shireen is a one-year-old girl who lives in Dhaka, the capital of Bangladesh. She lives in a very poor family. Shireen was born with a low birth weight, and she's still very short and underweight for her age. In addition, Shireen has repeatedly fallen ill from respiratory infections. Rachel, you lived in Bangladesh, so let me ask you, what role do you think nutrition might play in Shireen's failure to thrive?
Well, if her mother had poor nutrition during pregnancy, that likely affected the nutrition of Shireen when she was born. And if her mother wasn't able or wasn't willing to exclusively breastfeed her for the first 6 months, that would also negatively affect her nutrition.
And what about after 6 months, Vivek? What might some of the nutrition factors related to her failure to thrive be after she was 6 months old? Because she's a year old now.
Continued poor nutrition and not having access to the right supplements or nutrients that she needs.
Right. So one would hope that she might be exclusively breastfed for 6 months, and after that, complementary foods should be introduced in hygienic ways. And it might be that the mother's nutrition wasn't so good. The mother might not have been able to or willing to exclusively breastfeed for 6 months, and the family may not have the income or the knowledge needed to ensure that the child gets hygienically introduced complementary foods with a diverse diet after 6 months, even as she continues probably to breastfeed. Let's look at another vignette. Rachel and her mother live in Mombasa, a port city in Kenya. Rachel had already received her first polio vaccine, was soon to get, she's already received her first polio vaccine, and she's set to get another one. When the children in Kenya participate in polio days or national immunization days or child health days, they also receive supplements of vitamin A. Until about 20 years ago, vitamin A deficiency was related in a number of countries to blindness in children, or xerophthalmia as they call it. But today, as you look around the world, the number of children suffering from xerophthalmia or night blindness is many, many, many fewer. So tell me, Shaylin, if you would, why is vitamin A such an important addition to child health days and to immunization days in low and middle income countries?
Well, in addition to helping with eyesight, vitamin A can also provide children with a boost for their immunity to fight off diseases or illness.
So it turns out that vitamin A is incredibly important, as almost everyone learns in school, for eye health. But at the same time, some very pioneering research more than 2 decades ago showed that vitamin A is also extremely important for the general immunity of people. And vitamin A deficiencies are associated with excess morbidity and mortality in young children from diseases like pneumonia and diarrhea, for example. Let's look at our last vignette. Faiho is a 7-year-old boy in China. He was born at a normal birth weight, and until very recently, he was about average weight for his age and weight for his height. But in the last year or so, even though he's only 7 years old, Faiho has become obese. Emily, tell me, how is it possible in a world in which so many young children are undernourished that we're now looking at a world where at the same time many young children are overweight and obese? What might be happening to cause this?
Well, in some places, foods that are highly processed and have a lot of calories, but not a lot of nutritional value, are the least expensive, so parents might buy those for their children.
Okay, and what else might there be, Rachel?
And as economies develop, typically more processed foods become more readily available in places where they wouldn't have been available previously.
And Shaylin, anything else?
Well, if children are in an urban area as well, maybe they're not getting outside and exercising in an active way that children should be.
It's possible Fayo is playing video games rather than engaging in physical exercise, for example. And in fact, in China, a substantial proportion of the young children these days are actually overweight and obese. And in a few minutes, we'll look at some data on that. Now, before launching into discussing the burden of nutritional issues and what can be done to address them, let's look at some of the key terms that people use when they're talking about nutrition and global health. And I'm not going to dwell on these because you'll be able to look at them yourself at your convenience. But I do want to point out that the word malnutrition is used in lots of different ways by lots of different people and not always consistently. In this discussion, we're going to use malnutrition, as noted here, to refer to various forms of poor nutrition. This could include underweight or stunting, but it also could include overweight as well as micronutrient deficiencies. Malnutrition is poor nutrition, bad nutrition, but we're going to also distinguish between undernutrition and certain manifestations of that, and overweight and obesity. Let's look at the next graphic, which also has a few more terms on it. And we're going to probe these a little bit further in a minute, but I will also encourage you to take a look at these yourself. So let's go right on and look at the next graphic. And this one looks at indicators that we use to gauge the nutritional status of young children. First is birth weight, which has to do with the child's weight at birth. And there's a standard definition of low birth weight, and that has to do with a child whose birth is less than 2,500 grams. The birth weight of a child is a very important predictor of the likelihood that that child will thrive. And we'll talk more about what can be done to try to ensure that the child is born with a healthy birth weight above 2,500 grams. We also measure children in a number of ways. Any of you who have children or remember going to the doctor and being measured will appreciate and understand that we look at height for age of the child, we look at weight for age of the child, and we look at weight for height of the child. And we compare them to some standard or reference population. And we're interested in seeing where the children are in terms of these indicators compared to the median of the reference population, with half being below that point and half being above that point. And we have to pay particular attention to children who are substantially different from that median, whose height for age, weight for age, or weight for height is substantially below that median, because this reflects nutritional problems, sometimes acute ones, and sometimes problems that have gone on for a substantial period of time. And we'll be talking as we go on about stunting, which means they're substantially too short for their age. We'll be talking about underweight. They don't weigh enough for their age compared to that international reference. And wasting. Usually we think about wasting. In fact, Rachel, when might you expect to see some wasting in children? Under what circumstances might we see more wasting? We never want to see wasting, but under what circumstances might we see wasting or wasting suddenly kind of emerge in a population?
Wasting often occurs in conflict-prone areas where families all of a sudden lose access to nutritional foods.
Right. So wasting can reflect what they call severe acute malnutrition, just chronic failure to get enough food or enough of the right foods. But also we have to be aware that when we look at droughts or floods or conflict or other humanitarian emergencies, we should sadly expect to see a substantially larger share of the kids who are wasted than we would see otherwise. Now for adults, and let's go to the next graphic, we usually look at body mass index. And this is an interesting graphic of a kind I'm not sure I've seen before. But basically, this allows you to plot where you are in terms of being underweight, in the normal range, overweight, or obese. For adults, what you're doing is you're gauging nutritional status on the basis of what they call body mass index. And you're underweight if your body mass index is under 18.5. You're in the normal range if it's between 18.5 and 25. You're overweight if it's over 25, and you're obese if it's over 30. What we have here is height, and what we have here is weight for kilograms. And the formula is actually noted here, and that is weight in kilograms divided by the square of the height in meters, which I'm not going to trouble you with now. But the main point is, if you plot where people are on here in terms of height compared to weight in kilograms, this tells you whether they're underweight, normal, overweight, or obese.